Hey everyone, welcome to another episode of Healthzone with Gilbert Cheah. Thank you for joining me. My name is Gilbert Cheah. I am the editor of Healthzone Singapore, a Facebook page that is dedicated to covering health and wellness issues, specially curated from a Singapore and regional perspective. So, if there's one place that we should be safe from harm, we would think would be in our beds, right? But we know that staying in bed for too long can be detrimental to health. And even if you only sleep the required 7 or 8 hours, there are some sleep disorders that can wreak havoc with your health, and you wouldn't even know it was happening to you because you'd be asleep. We would just feel the effects and wonder why we are so fatigued and sleepy, even though we slept the whole night. But did you really sleep the whole night? Today I want to talk to you about one health condition that many people suffer from, but which many people are unaware that they even have. Some people may never even have heard of this condition, or if they have heard of it, they don't really know what it is. And this is sleep apnea. Now, sleep apnea is a potentially serious condition when your breathing repeatedly stops and starts while you're asleep. The most common reason why this happens is that your throat muscles relax as you sleep and block the airway. This interrupted breathing causes a lack of oxygen in the body, and your body automatically reacts by forcing your diaphragm and chest muscles to reopen the airway, resulting in gasping as if you're drowning. You wouldn't even be aware of it, but this interrupts your sleep multiple times throughout the night, which results in fatigue and sleepiness the next day. And this puzzles many sufferers as they have no idea why they feel so tired, even though they slept through what they thought was a full night of sleep. Now, sleep apnea can cause and increase the risk of health problems, including high blood pressure, stroke, heart failure, irregular heartbeats and heart attacks, diabetes, depression, and even migraines and headaches. Now, obviously, the poor sleep it causes also results in poor performance in everyday activities, such as at work and at school, car crashes and academic problems in children and adolescents. Yes, it's not only adults that can suffer from sleep apnea, children do too. Now, how common is sleep apnea in Singapore? It's surprisingly common, which explains why so many people are sleepless in Singapore. A study by Jurong Health estimates that over 30% of Singaporeans suffer from moderate sleep apnea, and about 10% have severe sleep apnea. But many people don't even know that they have it. So how would you know if you're suffering from sleep apnea? Many people don't realize they have it because the symptoms are mistaken for normal snoring, or they always feel tired. However, due to many serious potential health problems, it's so important that you get this problem diagnosed and to see a doctor if you exhibit any of the symptoms. Now, it's important to note this, that not everyone who snores has sleep apnea, and not everyone who has sleep apnea snores. But snoring, especially the very loud and rasping kind, is a common sign that your throat tissues are covering up your airways as you sleep. So these are the most common symptoms. One is loud, raspy snoring. Another one is choking, snorting, or gasping during the sleep. Pauses in breathing, waking up feeling short of breath, waking up with dry mouth or a sore throat, and feeling tired and sleepy even after a full night's sleep. If you have a partner, ask him or her to observe you while you are asleep and to look out for these signs. Or you can record yourself sleeping to keep track of your snoring, noting how loud and frequent it is, and if at any point you're gasping, choking, or making unusual sounds. So here are the signs to watch out for. 1. Loud snoring that suddenly stops and is followed by a pause in breathing. You actually stop breathing. Next, gasping or jerking as the body then struggles for air. Then the resumption of snoring, followed again by stopping in breathing and pauses in breathing. When people with sleep apnea fall asleep, they can actually stop breathing for 10 seconds or more, and some even up to a minute or more. The biggest telltale signs of sleep apnea is how you feel during the day. Normal snoring does not interfere with the quality of your sleep as much as sleep apnea does. So you're less likely to suffer from extreme fatigue and sleepiness during the day. There are several factors that increase your chances of having sleep apnea. And these include 1. Excess weight. Being overweight or obese greatly increases your risk of sleep apnea. Fat deposits around your upper airway can obstruct your breathing. 2nd, thick necks. Believe it or not, people with thicker necks of 40 cm or more have a higher risk. Next factor is your gender. Men are 2 to 3 times more likely to have sleep apnea than are women. However, women who are overweight or obese also have a higher risk. Next is age. Sleep apnea occurs more frequently in older adults and women who are post-menopause. Another factor is family history. Having a family members with sleep apnea also increases your risk of suffering from it. Another one is the use of alcohol, sedatives, or tranquilizers. And these substances can relax the muscles in your throat, which then worsens the obstructive sleep apnea. Another factor is smoking. Smokers are up to 3 times more likely to have obstructive sleep apnea than people who have never smoked. Smoking can also increase the amount of inflammation and fluid retention in the upper airway, and this makes it worse. Nasal congestion. If you have difficulty breathing through your nose, whether you have an anatomical problem or allergies, you're more likely to develop obstructive sleep apnea. There are certain medical conditions that make you more prone to developing sleep apnea. These include high blood pressure, diabetes, Parkinson's disease, prior stroke, and chronic lung conditions such as asthma. So what can you do if you have sleep apnea? There are certain conditions that cause sleep apnea which can be controlled or even eliminated. So I'm going to share with you now 6 risk factors and what you can do to lower these risk factors and therefore the severity of sleep apnea. 1. Lose weight. People who are overweight have more tissue in the back of their throat which can drop down over the airway and block the flow of air in the lungs while they sleep. Even a small amount of weight loss can open up your throat and improve sleep apnea conditions. 2. Quit smoking. Smokers frequently have inflamed and swollen airways, and this contributes to sleep apnea. 3. Avoid alcohol, sleeping pills, and sedatives before bedtime because these cause the muscles in the throat to relax too much and obstruct the airway. 4. Exercise regularly. Exercise has multiple benefits for sleep apnea sufferers. In addition to helping you lose weight, regular exercise has been proven to induce more restful and better quality sleep. Aerobic and resistance training can help reduce sleep apnea symptoms as well. And yoga is also good for strengthening the muscles in your airways and improving your breathing. 5. Avoid caffeine and heavy meals about 2 hours before going to bed. 6. Maintain regular sleep hours. Sticking to a steady sleep schedule will help you relax and sleep better. Sleep apnea episodes decrease when you get plenty of sleep. Now, in addition to these health and behavioral factors, there are practical things you can do immediately to help lessen or even stop your sleep apnea. One is sleep on your side. Avoid sleeping on your back, which makes it more likely for your tongue and soft tissues to obstruct your airway. Some people only experience sleep apnea when sleeping on their back. One of the ways to do this is to actually put a physical obstacle to keep yourself from rolling onto your back while you sleep. And this may sound weird, but you can sew a tennis ball into a pocket on the back of your pajama top. Or place a pillow on the mattress so that your body only has space for you to sleep on your side. Another way is to prop your head and shoulders at an angle. Raise the head of your bed by 4 to 6 inches to elevate your body from the waist up by, for example, using a foam wedge or a spinal cervical pillow. This is very useful for people who suffer from acid reflux as well. 4 is open up your nasal passages at night. There are many ways to do this. Breathing strips that stick to the outside of your nose, which help open up your nostrils, or nasal dilators, which attach to the bottom of your nose to open up the nostrils. Saline sprays, which help moisturize and relax the nose and throat passages. Nasal steroid sprays that reduce the swelling of the airway. nasal irrigation wash. There's something called a neti pot, which is a fluid-filled vessel that is used to flush or rinse the sinuses and nasal passages with warm water. Now, if none of these work, or if your doctor determines that you have a serious case of sleep apnea, there are other methods to tackle the problem. One is the use of something called a continuous positive airway or airflow pressure, CPAP. And this is one of the most common treatments for moderate to severe obstructive sleep apnea. The CPAP device is a face mask that fits over your nose and mouth while you sleep, and it pumps a constant stream of air that keeps your breathing passages open while you sleep. There's also medical treatment. If none of these measures work for you, or if your doctor feels that you have a more serious case of obstruction, they could suggest surgery to remove excess tissue from the back of the throat to prevent the obstruction of airways. Now, this should always be a last step after all other measures have failed. Surgery does carry risk and complications and in possibility of infections, and in some rare cases, the symptoms of sleep apnea can become worse after surgery. There have been people who have had a surgery in Singapore but still continue to have sleep apnea. I would recommend that you make an appointment to see a sleep specialist if you have a severe case. There are several in private practice, but I would recommend that you make an appointment at the Sleep Disorders Clinic at Singapore General Hospital. Now, the Sleep Disorders Unit at SGH is the largest in Singapore, and they offer the most comprehensive range of inpatient and outpatient services for people with sleep disorders. They treat the full range of sleep disorders, not just sleep apnea. The good thing is that unlike doctors in private practice that are usually solo practitioners, the sleep specialists at SGH come from a multidisciplinary background with respiratory physicians, ear, nose, and throat surgeons, neurologists, psychiatrists, and psychologists, and they're all working in a collaborative environment to find the cause of your sleep apnea and sleep disorders and to treat you. And of course, as a public hospital, their rates are far lower than what you would pay for doctors in private practice. So there you have it. This very surprisingly common yet dangerous, potentially dangerous sleep condition that affects many Singaporeans. And it's very important that you get yourself diagnosed. Do not just suffer or sleep in silence and it damages your body. This is something that you really need to watch out for. So be alert even while you're asleep. That's it for this week's edition of Healthzone with Gilbert Cheah. Thanks for joining us. I want to thank all of you. Our viewership rates have been going up very well across all of the channels that we're in on Facebook, on YouTube, on Spotify. And please do like and subscribe and give us your comments and share with your friends so that they too can have the best health. Thanks for joining us, and we'll see you next week.